Hello friends, I am going to talk about a very important neurological disorder called as stroke. What is stroke? Or to be more precise, what is brain stroke? Or in other vernacular languages, pakshaghat, lakwa, or commonly said paralysis. Stroke is a condition where there is sudden onset of a neurological deficit that happens because of the blocking of the blood vessels in the brain or a rupture of the blood vessels in the brain. What are the symptoms of stroke? As I said, it is sudden in onset. The symptoms that a patient of stroke may suffer, the common ones are sudden onset weakness of one half of the body, sudden onset slurring of speech or sudden onset language dysfunction, sudden onset weakness as I said, along with sudden onset numbness on one half of the body. There can be double vision, there can be difficulty in swallowing, there can be balance problem while walking. All these symptoms can suggest, when they come suddenly, may suggest a stroke. Once you have identified a suspected stroke, what should a patient do, or probably what should a relative of a patient do? The most important thing in the management of brain stroke is to identify the disease and to rush to the nearest stroke ready hospital. Now when I say stroke ready hospital, what I am trying to emphasize on is that just merely identifying the stroke by its symptoms may not help. Sometimes patients or relatives tend to take such a patient to a nearby clinic or a physician and waste a lot of golden time. Now when I say golden time, what I am trying to say is that the golden period that is given for stroke management is 4.5 hours. What I mean to say is that it is important that a patient who has been identified of probably having a stroke should be rushed to a stroke ready hospital which manages stroke in this golden period of 4.5 hours. So friends, what is a stroke ready hospital? Maybe you can just Google and find out. The keywords would be stroke management, stroke team. But by and large, a stroke ready hospital should at least have a CT scanner. If it has got an MRI, the well and better. There should be a neurologist who should be full-time available to manage strokes, and there should be a teamwork which works towards managing acute strokes. Many of the hospitals may be not having it, but there are many hospitals nowadays in India which are stroke ready. So preferably such a patient who is probably having a stroke should be shifted to a stroke ready hospital. Can these strokes be prevented? Well, that's a very pertinent question, because we have seen in our studies that by changing your lifestyle and doing just a few things can actually prevent this disastrous disease called stroke. Now, what are those? First of all, there has to be a lifestyle change. If you are a sedentary person, you should start walking, and maybe probably some moderate exercises are required. You should walk for at least half an hour a day. Some people say 10,000 steps would be a quantitative value for that. You should, if you are a smoker, you should definitely quit smoking, because smoking is a big risk factor for strokes. The food should be balanced diet, which should be replete or rich with fresh fruits and vegetables, and a lot of water, of course. Stressful life should be avoided, because recent studies have shown that stress can also be a risk factor for stroke. If you are a hypertensive, it is important that you take regular checkups and control your blood pressure. If you are a diabetic, it is very important that you regularly check your blood sugars and keep your blood sugars within control. Nowadays, the prevalent pollution, air pollution itself has been found to be a major risk factor for strokes. The heart condition. Sometimes patients may have a heart attack or valve problems which can also lead to strokes. By and large, these are the risk factors for strokes. Also, certain patients have got the pipes which are going to the brain, they are blocked, which are called as carotids. So, there are investigations by which you can by and large screen the pipes and find out whether there are blockings into it. So, if we are careful about all these points that I have mentioned, then we can prevent strokes to a great extent. Now, in India, we have been able to introduce the state-of-art management of strokes at par at what probably is happening anywhere in the world. If the patient is reaching a stroke-ready center within the golden period, then patient is evaluated, and if found to be fit for intervention, then the treatment is given to the patient. Now, what are those interventions? We give intravenous medications which can work as clot busters. Then there are vascular procedures wherein we can go via a wire and negotiate to the brain vessels and pull out the clots from the brain vessels. So, most of the stroke ready hospitals have got all the facilities. So, it is important, but again, as I would say, to emphasize that the patient should reach the stroke ready hospital in time.